Hi. We'll just wait a few minutes till everybody comes on. While we're waiting, let me know who's with us. Write to me where you're from, your name. You can write in the chat here. Hello, Paraskidi. Slowly, everybody's coming on. We'll just wait a few minutes. But while we're waiting, let me know where you're from, who you are, your name. Let's get some interaction here. Hello, Lily from Houston. What time is it there? It should be morning now. Okay, so anyhow, let's go on. We're gonna start off, and people will start coming in just a few minutes. Anyhow, so yeah, it's nighttime here. It's 9 p.m. here. No, so it's fine. It's fine. So first off, I want to thank you. I want to thank you for joining me today. And in your busy schedule, I know it's now the holidays. Everybody's running around. Everybody's really stressed. The stress of holidays. Um, uh, but I thought it was really important for us to connect before the holidays, and for me to help you shine, as therapists and as practitioners. So first off, again, I want to thank you for joining me. And we are all trained professionals. All right. We know how to use our device. We know how to heal. We heal people. We help regulate and rebalance people. But the thing is that many of us as therapists also have an overloaded stress load. We're overloaded, causing mental fatigue, causing emotional stress and weight, causing us to be not fully grounded. We're functional, but we're not fully grounded. And many times we as therapists leave ourselves last, unfortunately. And it's something that I always tell my students is that, we are a triangle when we're doing therapy. It's our student, it's our clients, it's us, and it's the device. So we're doing therapy, and all three factors in the triangle, okay, have an input in the therapy at the end of result for our client. Our client comes to us for therapy. They have their chronic stress, they have their issues, they have their symptoms. The device does part of the work, but we're also involved. And we also have to remember not to forget to do therapy on ourselves, for us to shine, for us to be better, because we are also part of that triangle. Okay, many times my clients tell me, I don't know what the device does, but I come for you. Okay, and remember, always have this in mind. Would you go to you as a therapist? That is a very important question as a professional to a professional. Okay, when you go to yourself as a therapist, okay, look in the mirror and see what you're doing. So this is why this today's session is very important, because I want you all to shine. I want you to be well, and I want to get that load, that chronic stress out, because I know we all have it, right? We're overloaded. So most people don't even realize that they are deregulated, because our body is an amazing factory, right? And it knows how to adapt. Our body knows how to adapt, and it knows how to function. And we see it in our device: adaptation phase, right? Or exhaustion phase, which is complete exhaustion. But we can also be in adaptation phase. And adaptation phase is just as dangerous as exhaustion phase, right? So this chronic fatigue and chronic stress comes at a cost, and we need to resolve it. All right. So today in our webinar, we're going to understand how we can see the stress and the amount of stress and the overload and how it persists in our body. We'll learn how our body stores stress and how it affects our nervous system. We'll learn how to ground and balance and be more confident and shine. All right. And we'll also discover through quantum biofeedback all the possibilities that we can do. Right. So let's start, and I'll be talking about, as we go along, all the the theory behind. So I want to put us as a group, all right, and see where we are at. So I'm going to name as we are the holiday. How did we call ourselves? How did we call ourselves? We got the holiday special webinar group. Okay, holiday special webinar group. I spelled webinar. All right. And I assume we're both female and male, so I'll leave both. Date of birth. I don't know if I'm the oldest, but I'm just saying I may be the oldest. So I'm going to put myself here. All right. And I was born in Syracuse. But I was born in Syracuse. Maybe we can't put today's date, but the thing is, some of the things that may be coming out may come up as a baby. All right. And that's the thing. So I like going with the oldest. All right. So that it could cover all of us. I'll put here in Athens. Oh, it should be for you. Okay, I'll put you. All right. Right. So I don't know the month, the year. 219854. No, just 54. I'll just put 54. So I'll put today's date with 54. So the day is 17 and 54. How's that? That's fine too. Place of birth. Here in Athens, since I'm in here, I'm working from here, possibly. Greece. All right, and let's go to birth time. 9:24 in the morning. Okay, 9:09 now, but it's PM. All right, that's fine. Okay, and we'll save. Now, the thing is with the SOC, there's a lot of us involved, so we don't know. I'm just going to put in general how we may, I don't know if we have any organs removed. I'll just put one maybe for tonsils or whatever. And let's say we're like one medication and that we don't smoke, and maybe we have like 2 amalgam fillings for the older people. Mental factors, I'll put 1. Diet 3. Personal stress, how's that? We'll put 8. All right. And 10. All right, we'll put 10. That's the thing. You see, we're therapists and we forget about ourselves. And that's why I thought this was so important for us to do this today. And so I can help you. So we'll put job. All right. We'll put job. We'll put struggle with self and money. Okay. That's always a factor. And maybe family stress. Maybe some issues with sleep. Right. I won't put any alcohol. I'll put like 1 coffee. I hope we all do our exercise. I won't put sugar, but we're always that hidden sugar. All right, toxicity, living in a city. All right, since I put that we have removed 1 organ, we'll put 1 injury. Major infections, I won't put any. I assume that we're drinking our waters, right? At least 5. I wish we had a picture of all of us. All right. But I don't. So we'll just close and let's go. And calibrate. So while we're calibrating and while we're testing, I want to go over a couple of things. First off, one thing that we are going to go over is the pineal gland. And why? Because the pineal gland is that gland, that part in the brain of the endocrine system that regulates our circadian rhythm, right, in our sleeping mode. And so it helps with our mood, it helps with our energy, it helps with our wakefulness. Okay, so it's very important that we're going to be working and supporting our pineal gland for melatonin and the circadian rhythm to help reduce that stress and help us find our coherence. Now we're going to be also checking out how we find how coherent we are. I don't know if you guys know it, but we'll be going over this. Do you want to close the calibration? Yes. Now, some kind of jewelry or metal disturbance is detected. I am wearing jewelry. So sometimes when this comes up, you can tell the person, okay, now you can take that off because it seems that there is a disturbance with the jewelry that you're wearing. A lot of people ask me, should I take my jewelry off before calibration? I say no. Leave it on so we can see if it bothers you or not, if this blocks you or not. So apparently, maybe this is blocking. All right, because this is, remember, metal around my thyroid. Interesting. Anytime I wear a necklace, it always comes up, by the way. Interesting. So do you want to close the calibration? Yes. Let's go to testing and let's prepare. Now, before I do the testing, I want to go to the orgone generator. Now, I want to say a few words about stress and what stress does to us. As I said, stress and chronic stress in general doesn't do anything to us because, as I said, our body and our whole neurological system is an entire factory and it knows how to self-adjust. But if we don't give it the rest and the grounding needed and we don't help our body reset, okay, we go into chronic stress. All right. Our body is not made to have a continuous stressful situation. It's like, imagine yourself in a car and you have your foot on the gas pedal, just a little bit, and it keeps on, you have that your foot rested on the gas pedal. If you have your foot rested on the gas pedal and it's just, driving all day, 24 hours, at some point, your car is going to overheat. All right. Even your car needs to rest. Everything needs to rest. If you can't always press and press and press. And so our body needs to reset. The thing is that if we don't let it reset, it goes into chronic stress, as I said, and it goes into deregulation. Now, having said that, no matter how many affirmations you put here, no matter how many whatever positive thoughts and everything, if your body is in chronic stress and neurologically it's overloaded, it won't listen to any affirmation. Affirmations will start going in as soon as your body feels safe. Your body, when you're on overload, it's trying to find rest. So no matter how much you tell your body, okay, I feel great. I feel whatever, it's just not going to sink in until we work neurologically your body. And with quantum biofeedback, it's amazing. We reverse that. That's why I have a specific process in the beginning, and I call it the startup, to make the person within the first 10 minutes relax. And thereon, anything you do afterwards is just absorbed. It works really good. Okay. But having said that, what we can do, though, is we can first I invert. Okay. Instead of putting an affirmation, we can change the affirmation a little later on within the therapy. All right. Now, in the beginning, when we're working on an overloaded system in the beginning, right, we can put I invert stress. I invert chronic stress. I am relaxed. Okay. So I like putting the field in 888 for infinity. Now it's up to you. Some people put 1,000. Some people put 100. It's up to you. I like infinity, and I like to put spiritual harmony, spiritually to find myself. All right, an interactive and activate orgone field. Now, having said that, right now we can add more patients. Now, because I don't have everybody's names here, what we can do is put all participants of the webinar. Okay, all, let's say, live participants of the webinar. Now, quantically, it'll get us and it'll catch us, all right? Because that's my intention. Now, I want to give you a little hint. There is this woodpecker. Okay, the woodpecker magnetic field, ELF magnetic field, is a pulse that, if you do it for 1 minute, will help the most difficult client immediately accept what you're doing to them. All right, because they will go into that mode of hypnosis. This woodpecker electromagnetic field helps with the electrohypnosis. So it helps whatever we're going to be doing here on going deeper. So this is really good to do for addictions, let's say. It's good to do for people who have compulsive thoughts and overthinking. Now, one thing that chronic stress does, it does affect overthinking. It does affect, the mental thoughts and over intellectualization that we see in the aggravations, right? So this is really good, especially for difficult clients. Little hints. All right, I'm going to try to give you as many hints as possible today so I can put you forward. So let's close here and close, and we are ready. We've done Organi Active, and let's go into testing. Now, there's so many ways that we can work, and we have so many applications, and I want you to know this, that, nothing is wrong. Other times, depending on the situation and what I want to focus on, I would go into electrohypnosis here and put the affirmations. But right now, because what I said before is, when a person is overstressed and they are in chronic stress, affirmations is not what they need. We need to work on them neurologically so that we can set the bar a little down and reduce that stress on them, so thereon we can do electro hypnosis and help the person with affirmations, etc. So we have 3 minutes to go over theory. So, as I said, stress is meant to be resolved, okay? But chronic stress interrupts this cycle of stress. And that's when we go into deregulation, dysregulation, or dysfunction, all right? Chronic stress doesn't just exhaust us, okay? It trains the nervous system to stay on, okay? Gets adaptable. And over time, rest feels just unfamiliar. It's just something that we just don't know, okay? And then calm feels unsafe, right? The calmness feels unsafe. And we feel safe in that high stress mode, all right? So this therapy is just not a press of the button. If someone comes to you and there are issues around chronic stress, they may not only need one therapy, they may need quite a few therapies to get them back on track and their body to feel safe in calm mode. All right. They have been working at such a high level. Our days the life we are living now is so challenging in all respects because it's high paced, with technology running, with everything. There's a lot of demands on us. The demands that we have today is nothing compared to what our parents had and what their parents had. Of course, all lives have their own demands and have their own challenges, but I think that the life that we're living now is so demanding, and there's just no time, and it is challenging, and we need to find that time to help regulate our system. Okay, 3 minutes passed just so fast. All right, so let's take a look at the VAR-HOPE really quick. Volts, 67. Our volts are only at 67. There's the chronic fatigue. There's the adrenals. It's low, right? Now, I want you to ask me questions if you need any questions, right? I'm looking at the chat. So if you have any questions, just remember to ask me and I'll answer whenever I can. We see amperage is also low. That's the brain function. When I'm talking about nervous system, that's the brain. The nervous system is here, right? This is where it starts. This is the factory. And that's the brain. The brain function and serotonin levels is low, and so are our volts. Our resistance is okay. Our hydration is great. Oxygen is borderline. We need more electrolytes, though. Guys, electrolytes. Our electron pressure should be higher than our proton pressure, and this is an indication that we need electrolytes. Where do we get electrolytes? Either from electrolytes. Okay. I personally take. I take electrolytes every day. I have really great electrolytes. If a person doesn't want to take supplements or supplementation, They can start at least having at least 3 fruits a day and their salads in every meal. See how they go and see how that goes. If it still doesn't go up to how it should be, then they need also to take electrolytes because something may be off because it's chronic. All right. So resonant frequency pattern is an indication of our neurological system. So neurologically, this is a great number. Okay, it's not that bad, but there is a regulatory dysfunction in the EEG in the brain. So I need to look deeper into that. All right, cellular vitality is at 7. I would like a higher number, but it is above normal. Phase angle, though, is only 6. It is normal, but I do want it higher. This is the phase angle is your cellular health. It's the mitochondria, okay, and your powerhouse. This number is a very important number, okay, for free radicals in the body and degeneration. So we do want the higher the better, even though 6 is at normal, but we don't want to be just at normal, okay, because it's just 1 point away from being chronic and below normal. I want it higher, all right? Phase response is how your body works as an orchestra. That's good. Body is working as an orchestra, and that also has to do with the resistance here, about toxicity, etc. So that's good. And the impedance is how the energetic field is flowing throughout your whole body, and that's a good number. So from my first indication, what I need to see is the electrolytes is off, and electrolytes is electron pressure is definitely, it's not only a factor of what we're eating, what we're drinking, but it does also have to do with stress. All right, and the more stress we have, the more electrolytes we may need. And we do see an indication here for volts being low, so that may be there a factor, and our brain needing more electrolytes for the electrical pulses. Remember, deregulation happens in our body because electrical signal from chronic stress, because electrical signals are not going to where they should be going, and we need excuse me, electrolytes for those electrical pulses. Our device, excuse me, one moment. Our device not only does therapy, but it also, remember, gives us the information, and we have to know what it's telling us. We have to know how to read what it's telling us. All right, so that's electrical information. Now here, our little blue box. The highest number is spiritual. Why would spiritual come up? Spiritual is our inner guidance, right? Our goals, our intentions, our inner guidance somehow is not aligned. Something's going on there, okay, spiritually. And, our somewhere there may be confusion on our identity, maybe, or something there. It needs more investigation, but that's our highest stress and mental thoughts. So this, again, is a matter of stress. Now, having said that, remember, our stress that we put 10 out of 10 makes us unaligned. It makes us have brain fog. When we are free from chronic stress, we're happy. We feel good. Okay. So these are two factors that we have to look at. Let's take a look at our matrix now. Now, adrenal stress. Adrenal stress. Now, I don't know if there's anybody that's pregnant in our group, because remember these numbers are our group numbers. Is us as a whole. We feel like we're 70. That's the chronic fatigue. Okay, so let's take a look here at the brain. All right, brain. Brain, when I filter brain, it means that we are filtering our neurological system, right? That's what we filter. There we go, brain fog. Oops, brain fog. Migraine. Maybe some of us have migraine, immune deficiency. Stress obviously does create immune deficiency. Brain fatigue. Now, we can never have enough omega-3 for our brain. Omega-3 is very important for everyone. And as we age, we need more. Okay. And this will help clear that the fog. All right. So even 2 and 3 per day for my age and our age is important. The more we have, the better. All right. 1 is for younger ages per day, omega-3. Memory disorder. Okay, I want to see dementia. So memory, encephalopathia, trauma, Alzheimer's. These things are coming up. Okay, I want to see though, clear search, stress. Where that is at. Do we see this blood pressure for us? Geopathic stress is affecting us. Tension, stress here. Stress for vitamin B. Cortisol. Maybe it's more chronic. Okay, how about stress, anti-stress? I want to find the chronic stress. This one. It's at 49, depleted adrenals and adrenal fatigue. Let's put that on the yellow panel here. Return to main, and let's do an individual reaction. Okay, an individual reaction is where we're testing a specific item on us that may have come up in the chronic, but we're seeing what it is actually. There we go. There we go. So although it's chronic, okay, I need you to understand the matrix on one hand is giving us indications what is now and what is chronic. But if you do individual reactions, it will also test specifically if we are reacting to it now, because some chronic items may be sleeping. So they're not upfront. They're not so evident or on us. They're sleeping, right? Right now, our stress depleted adrenals, we are reacting 93%. So that's a high number. And we are resonating. So it's resonating means also the emotional connection. So we're at 95%. So there we go with the stress. It's there. Now, the other number that I wanted to show you is the coherence. The good thing is, guys, we're at 96% coherent. So we are coherent. That is good, because many times chronic stress makes us off. The mind and body connection is off. Okay. So we as therapists, we do have our chronic fatigue and depleted adrenals, but at least in general, we are coherent, and that's important. All right. This is an important number that you need to always look at to see if a person is coherent, because if they're not, we need to work on it. We need to work on that coherence. Okay. All right, and why do we need to work on the coherence? We're working on coherence because coherence, it means that we're aligned, we are in harmony, we're in balance. And it means that our body is synchronized, right? And all our bodily symptoms are synchronized. Brain waves, the heartbeat, the synchronization. If that's off, this is off too. So if coherence is low, we have more stress. We don't have enough focus. Let me say it differently. If we have coherence, means we have less stress, we have more focus, we have better immune system, or we have better emotional resilience, more intelligence, more stability. All right. So the coherence number is very important for all these reasons. Now, I want to ask you something. On a scale of 1 to 10, okay, how do you guys feel right now at this point? I haven't done much therapy on you yet, but I want to know right now how you're feeling on 0 to 10. Just give me a number in the chat box. Because I want to do a little test on you. Give me a number, right? Like right now, I feel on a 0 scale of 10, I feel my energy at a level. I feel 7. I feel energetic because I've taken a lot of vitamins, so I feel 7. All right. How energetic do you guys feel right now? Just give me a number. I feel 7, for instance. You feel stressed 10, 5. The others, I need 16 numbers. We're 16 people. 7, 0. Oh, Lily. Let's fix that. We need to fix that. Okay, so 0 energetic. Gloria's at 6 energy. Okay, so having said that, I want to do a little test on you, all of you, and we're testing the coherence right now. I want you, the right hand put on your head and your left hand on your heart. Okay, and I want you to breathe deeply through your nose. Hold it just a second. And breathe out. And now breathe through your mouth. Hold it. And exhale. Okay. How do you feel? How do you feel now? This was just really short. A really quick reset. Just a few seconds reset. But how do you feel? Right? This is how you tell your clients that, you need to reset. You need to give your body some time. And that's why we go into biofeedback and we're helping their body reset. There's nothing wrong with them. They have to understand that it's not them that they are the problem, that they feel fatigued, that they feel lazy, that they're this, that they're that. It's not their problem, but it's the chronic stress that has caused a physiological issue. And we need to help with their coherence. The body, the mind, and the body, right? The coherence of the mind and the body, and giving themselves oxygen and helping their body working it. All right. So the one number that you need to see is the coherence. On any individual reaction that you will do, always look at the coherence and make sure that they are coherent. As they come and they come back and forth, and you have to tell them the only way that you are going to start becoming more coherent is giving your body time to reset. And the best time to reset is their sleep. That's why I said in the beginning, we need to also work their pineal gland for their circadian rhythm. All right, ask them, how many hours per day do you sleep? All right, my client last night, that's full of stress, full of this, that, and whatever. All right, for years, he was only sleeping 5 hours. I got him now to 6.5 hours, but he's still off. He's still off. He's better than before, but he's still off. He needs to go to at least 7 hours. At least 7 to 8 hours is ideal. All right. Anything less is not. All right. So what it's giving us here as information that we do have depleted adrenals, and we need to detox. There's an issue of detoxing, and it's nervous. It's creating neurologically the brain. That's why EEG is coming up. There's a story being told here. You just have to connect the dots. So we can do a quick zap, because we did, just by doing the individual reaction, we got the rectification up to 83. So let's do it just one more time to get that number up. So remember, stress is not just mental. It's not just a mental thing. It's also stored. It's stored in the body, and it's long-term. It's chronic. All right, and it just overloads. It's something that I always tell my clients. This is your bottle. The bottle here, let's say, is your body. Your body can handle a lot of stress until a certain point where that just overloads. But when it starts going higher and higher, that's where the chronic stress starts going deeper and deeper into the body. And in order for this to go down, we need to have that reset. The reset is our sleeping time, our grounding time, our time. Me, myself, and I, how we say it. All right, let's close this. And let's load our first items here. And let's go to short start codes to load in our piggybacks whatever needs to be loaded: connective tissue, bacteria is coming up, chromosomes for the Alzheimer, etc. Let's load that, close. And I do, since EEG was coming up here, I do want to do a quick little therapy here. All right, let's do it one more time. We want the repair to be the highest number from all the rest. Oh, that's the second time. Let's do it a third time. $42. Okay. It's not a high repair number, but it is definitely higher than the rest. All right, so let's close here and let's go to pineal. Look, always notice where your cursor lands when you close the panel because it's trying to tell you a story. Now, pineal gland is one of the first things I told you to we need to work on, and we need to also piggyback it for our hormones, for our circadian rhythm, for our mood, for our energy, for our sleep. Okay, so this is not by chance. I want to load this here into my little blue box. Okay, maybe that's why also spiritual came up. And I want let me do like a really quick treat. All right. And I didn't go to the go-to index number after I did the individual reaction. So let me return to main and go to index number. Tonify the womb and induce labor. Now, this is really interesting. I don't know if anybody is pregnant, but eclampsia came up in the main matrix. And now this one, is anyone pregnant? It's interesting. If you are, wow. I'm saying, wow, how we picked it up. Just let us know because it's interesting, right? The quantic field and how it picks up things. All right, so let's go to our risk profile now. Okay, now this is what I wanted to show you. Remember I said in the beginning about adaptation phase and exhaustion phase. And this is the Sallier bar here in the risk panel. Alarm, adaptation, and an exhaustion phase. Now, we are in between adaptation and exhaustion phase, and that is not where we want to be. No. All right. Adaptation phase is where we are in the chronic adrenal stress mode, overfunction, dysfunction, fatigue, etc. And we're moving towards exhaustion phase. That is not a good indication. Okay, so it's good that we're doing this class. All right, so this is one place where we see again. So we did the individual reaction. We are in depletion, adrenal depletion. Okay, we are going towards exhaustion phase. And when we are in exhaustion phase, we are at risk for all these. Now look, cholesterol is coming up. If a person doesn't sleep well, cholesterol does go up. Toxicity, neurological, there we go. The neurological system is affected from chronic stress. The kidneys, respiratory, cognition, there's the Alzheimer's, the memory that was coming up. All right, all these. Okay, so this is an issue. So let's load all these items here. Okay. Load everything that's over 90. Okay. Now we can also do hypoadrenia. Why would hypoadrenia only be at 86? Because that's not a risk factor. It's an issue, but our risk factors are these. And what this is telling us here, vitamin deficiency or excess. Okay, first of all, if we are in need of vitamins. Okay, first of all, as we age, we need vitamins. When we have chronic stress, we need more vitamins because our vitamins are not being absorbed as they should be. No matter how good a person eats, we don't know how much they absorb because of the stress. All right. So, and the thing is that a lot of people say that they eat well, they think that they eat well, but they forget. I mean, it's difficult to eat well. Okay, it takes time. It takes, basically it takes time. It takes time and a lot of thought, and we don't have that time and thought. And it also takes knowledge. All right. Some people think they will, and they really don't. All right. So there is an issue there. Water, acid, alkaline, that's the electrolytes. Something's off there. Cholesterol, sensory toxicity, etc. So I loaded that. We can do a treatment here. I'm not going to do it now. I'm going to zap close for now so I can go on. And I want to look at the auto zaps that came up. Doesn't mean that we have HIV or AIDS, but it means that our immune system is compromised somehow. There's dental disease coming up. Dental sarcoids are dentals we need to be careful of. Worms, bacteria, and funguses coming up. Again, cholesterol due to stress and adrenal stress. STDs are also coming up along with the AIDS. So, something, our immune system is compromised. Feel good hormones and feel good in general. That can be, it's the mood, the emotions, mental health. There we go. And some erectile dysfunction. If I want you to know, in case we are all women, I don't know if there's any men, why would erectile dysfunction come up, let's say, to a woman? Because it can be an issue of testosterone. All right, so have that in mind. There's always a reason why something comes up, and we need to know and understand why. If you don't understand it, search. There's so much information at our fingertips now. So search what causes erectile dysfunction. It's an issue of hormones and testosterone, and women also have testosterone. So, you need to look in deeper. Don't just say, oh, the device is wrong. No, the device is never wrong. There's always a reason behind it. Stress, malabsorption. Yes, definitely. Stress causes malabsorption. You're referring to the risk panel. Sorry, I didn't see your comment before. It's the malabsorption syndrome. Definitely. All right, so let's go to the universal biofeedback therapy. This is where, from the beginning, and this is where I stopped talking with the clients, by the way. I stopped talking here because this is where I go neurologically, right, to the vagus nerve. We do the vagus nerve, the sympathetic, and the parasympathetic, and back to the vagus, because this is the spot where we are working the nervous system and trying to reset. From here on, they are starting to relax and feel safer. And from here on, we can start putting in affirmations and working other things, going deeper, making them feel safe. If they sleep with you, it means they're feeling safe. All right. So it's good for a person to sleep, and I tell them that many times. People don't sleep in the first session because they don't know you, they don't feel comfortable, they'll be yawning, etc., etc. But thereafter, they know, and I put the music on. I have a nice atmosphere. Okay. So while this is working, we can put the body viewer. Now, I usually like, when I'm putting the body viewer, what did I do? I double clicked on this, and now, okay. All right. What I like to do on the body viewer in the beginning, I like to do the unconscious choice. Let that run, and let's see what, we're going to see what therapies are going to be loading. These are the unconscious choices. So allergy, that's inflammation. So yeah, adrenal stress, definitely there is inflammation there. And remember when we did the individual reaction on the adrenal stress, what came up? Toxicity. All right, so there's an allergic reaction probably there. What else is coming up? It's still working. Sensory is working, all male. So either our male hormones or a male in our group is all in the reds. The cranial is, I don't know if anybody has a headache. That indicates headaches. Now, why would wine come up? And women, we're all both in the reds. So all our hormones. So sympathetic only went to 59%. That's giving us the indication that we need to do it a second time as well. So let's go to the parasympathetic. So we are really, really stressed, all of us. Let's go into the iridology also. Now, I could have done this from the main panel, but since I went directly here, there's another way where we can see aggravations and causes, and it's by going into the iridology here and going to the emotions tab here, and we see the risks, aggravation. So if you haven't seen them in the main panel, you can always see them here. Let's go to the causes first. So allergies, allopathy. And so allergies doesn't mean allergy as allergy, but it's telling us that there's inflammation in the body. And that's interesting how it comes up here as causes, but it also works on the body viewer. And there is the stress. Excess nutrients can either mean that overeating is an issue. We shouldn't overeat. We need to eat small meals many times during the daytime and not big meals, because big meals stresses us and it doesn't give us the proper energy. And especially when we're talking about malabsorption, right? In order to rectify the malabsorption, we need small meals many times during the daytime. So even the parasympathetic only went to 81. Wow, this is rare that this happens, but it means that we're all really stressed. Okay. So let's go back to the causes. All right, there's the stress, the meals for the malabsorption, toxicity. Okay, let's go to the what's aggravating us. Sugar. Now we're approaching holidays and the sugar is going up because people are giving us, little treats and stuff. Okay, so that's an issue that aggravates us. Now, I have people, people do tend to lie a little bit. Right. The guy that came to me last night, right? One of the aggravations on him here was the alcohol, right? And it was one of the peaks. And I said, but he says, I don't drink. I said, well, for some reason it's coming up. And it's coming up because maybe you don't drink like another person may drink much more than you, but for him, the number is low, but for you, it's high for that small amount that you drink. Well, to tell you the truth, he said, now this was yesterday, Tuesday, he said, on Sunday, I had 2 glasses of wine. On Monday, I had 1 glass of wine. And on today, Tuesday, I had another small glass. And I said, well, that's 3 consecutive days of wine. And that's not good for you. You are already, I accidentally pressed vagus nerve a second time. Anyways, a third time. I meant to go to the sympathetic and parasympathetic. Um, so, either he lied in the beginning or he forgot, because we do forget also. In general, he says he doesn't drink, but he said it happened that in 3 days. I said, well, the thing is that for you, it doesn't suit you. Even that small amount that you drank, it's not like you drank a whole bottle, but you did drink 3 consecutive days. And you may have not drank enough water, because alcohol, remember, dehydrates you, so you need more water. You don't sleep enough. You only sleep 6.5 hours. So, all this creates an issue. And because his alcohol level was really high in the aggravations. Just like us, sugar is the same thing. A person, like, I don't eat sugar. I say I don't eat sugar. But there are times that they may bring me some chocolates. The other day, they brought me chocolates, and I had some chocolates. Then I gave the rest of the box. I gave it elsewhere, but I did have it. And then I said, no, I don't drink sugar. I don't eat sugar. Yeah, but I forgot. I ate sugar, and that may have aggravated us, or whatever. So we have to sometimes remember, sometimes we do forget. And, these things are aggravators for us. So, yeah, we do the sympathetic and we'll do the parasympathetic one more time. I hope you guys are feeling better. So let's go to the body. Look how many things came up. Women, conceptual vessel, cleansing the astral body. This is spiritual. Interesting. And the corpus callosum, the left and the right brain connection. Okay. And the male heart and allergies. So let's put now adrenals, endocrine, adrenal. Okay, therapy, inflammation, allergies, since allergies were coming up, immune, and definitely stress. Stress and nutritional therapy for the malabsorption. Psychological, let's put the left and right brain for the corpus callosum, relaxation, all right, and anxiety. Let's do an aura cleanse. Our aura is beautiful, but we do need to boost that energetic field. There we go with the thyroid neck area. Amazing. Okay. One next thing I want to see is the brain. Do a start here. Okay. All right. And let's do an unconscious sacred geometry and life tree connection to the ground. Interesting. The grounding. Chronic stress affects our grounding. Okay. It's interesting how that came up. So we're doing a brainwave pattern therapy. Let's see what's going to come up. So what's important, first off, our goal is the normal to be the highest number. Okay. Now we have to look at a combination of what's going on here. The highest number here is at beta, which is stress related. But there's also an issue, and the marker went to delta for insomnia. So we need to work insomnia, all right, in combination with all this. What's coming up? Environmental stress, manic pattern, inability to focus, which chronic fatigue does that to us, obsessive vitamin deficiency pattern, again. Electrolytes, there is an issue with the minerals, all right, in the brain. Fear, obsessive aggression, inability to focus, second time. Okay, that's the EEG coming up. So our goal here is to get the normal the highest. What I would do one more start. And while that's working, what do I have working? I have, let's go to our pulsar here. I have the body viewer working. Let's go to the anatomy here and do an unconscious choice. The thoracic. We could also put a second sacred geometry and do an unconscious selection here. Pathway to self-awareness, activate. So that's self-awareness is very important. When we're talking about chronic stress and adaptation mode, our body tends to adapt to that stress, right? And we become unaware of what's actually going on in our body. That's the problem, okay? And that's where we have to start increasing self-awareness. When you see messages like that of self-awareness, this is what that means. It means that our body has adapted to the stress. And it's not aware, the body is not aware of what's going on. It's what the test that we did. All right. So we need to do this a couple of times. This may take 10 times and you still may not get it to normal. Okay. And that's normal because when there's chronic stress, this needs time. This may take a couple of therapies, but usually when you have a person coming in and you're doing therapy and you're doing this to them often, within 3 or 4 times, it should go to normal. Okay, but for a person that you haven't worked on, that there's chronic stress, this may not, you may do it 10 times and it still may not rectify because they need to start sleeping better. They need to start taking vitamins. They need to eat smaller meals for better better absorption. They need to drink more water. They need to have more electrolytes. Okay, so give them homework so they come back and you start doing this again. All right, it's not because the device doesn't work. You know, people say, oh, it's not rectifying. It doesn't work. All right. It's not like that. It means that you need work. The person needs work. The person needs to do their homework. There's mineral deficiencies. There's insomnia. There's other matters affecting the brain. All right. So you need to do it a couple of times. Give them some water if you see this doesn't rectify. Give them some electrolytes and do it again and see how this goes. Okay. I remember I had a person that when I was doing their EEG, the EEG in the beginning that we do, and it just wasn't, it was like almost straight. It was just like really little. It was a straight line and then a straight line and then an up and down. And I'm like, you know, what is going on? Is there something wrong? I was like, you know, I changed the harness. No, everything was fine. I gave them water with some electrolytes and then it started going. Okay, so it's not a matter of only the device, it's a matter of the person and what they're doing. So we're back almost, we're close We're still close. There's still an issue of insomnia, obsessive inability to focus, lack of good sleep. Okay, let's do it one more time, see how it'll go. Guys, drink some water. Let's help the device. Let's see how it'll go. If we all drink some water, let's see. But I think we also need sleep. I won't keep you so long. I don't know. Yeah, some of you guys, you're in the United States, so you have it's morning or afternoon. I just want to go. I want to give you some more tips, and then we'll wrap it up so you guys can go to sleep. All right. So again, there's some still asymmetry going on. You know, these are electrical brainstorms. All right, that may be going on. Someone may be having a head. Yeah. Well, you know, there's other things going on, Lily, that you may need. I don't know how your vitamins are, how your sleep is going, what messages are coming up here for you. Maybe you need some electrolytes. Okay, you may need work there. The lack of good sleep is definitely coming up here, and it came up quite a few times. So, you know, if it doesn't rectify, it's okay. You leave it, and then, you know, you just follow it up, jot it down, and do it the next time. All right. Now, let's go from here. Now, normally I would do the meridian therapy. Okay. But let's do a little meridian therapy. Okay, since it's one of the top suggested items, let's do it. And I want to put here chronic stress. Chronic stress and fatigue. And fatigue. Okay? And let's test the meridians. And what this does, this method, is it shows us which meridians have been affected by our chronic stress. Let's take a look. Now, while those are working, let's put the third eye stimulation for our pineal gland. Let's activate our pineal gland. Now, oops. Let's do an unconscious frequency search. Ascension, going up higher, healing door to all diseases, subconscious and ultra conscious. Interesting. Therapy, frequency, and unlimited mind power and control. Good one. I'm going to also choose the calming and relaxation. And how about self-awareness and the awareness? All right, do long. It's interesting. It went to 936 hertz. We went the highest frequency, 4. Let's go back there. 4 enlightenment. Interesting. And conscious awakening life state. Okay. And working our soul. Let's do a long-term therapy here. And start. Okay. And let's go. So, this is interesting. The greens show us that they're greatly weak. So the ancestral meridian, so it's our tendency, DNA, right? The spleen meridian, has to do with the circulation. Let me take a look. How the spleen meridian in connection with chronic stress. Yeah. So because chronic stress does cause stagnation, and it causes stagnation also in the spleen meridian, definitely creating issues for digestive issues, fatigue, anxiety, and mood swings. Chronic stress injures the spleen, disrupting all its function. So, stimulating the spleen, it will help with restoring balance. Interesting. Um, some herbal remedies that can help with the spleen meridian can be ginseng, astragalus, and licorice roots. With the mind and overthinking. Thank you. Thank you. So there we go with the overthinking, right? With the chronic stress, that is a factor. So we have corrected the spleen, and let's see the liver, intestine. Right. So remember when we did the individual reaction for the stress depleted adrenals, it came up that we do have to do detox. And the liver meridian has to do with detoxing. And there is an overload of toxicity. And that's interesting how it came up green. All the greens are those meridians that are greatly weak due to the chronic stress. Now, how about the ancestral? Right. So for the ancestral meridian has to do with reproductive and the vital functions. So because stress affects stagnation and the chi energy in general, these affect the reproductive and vital functions. Now, this is interesting. Remember in the body viewer how the entire female and the entire male was coming up. I mean, there's just the stories are just starting to connect, right? And hormones, etc. So the whites are greatly improved, the reds are slightly improved, the reds are the fuchsia. So the green ones were the ones that needed most in connection with the chronic stress. I like doing this method because you go and pinpoint exactly what issues are, and then you can do the start meridian. So what else is running here? Okay, I'm not going to put any other piggyback running because those, I have also the webinar running, and my desktop will start getting stuck because I have too many things running at the same time. Have that in mind when you put depending on your laptop and your RAM that you have and the memory, that affects how many piggyback functions you can put at the same time. If you have a really good laptop, you can put all piggybacks, but normally it's up to 3. Okay, for me to put any other piggyback programs, I'd have to close one of these and put the other one on, especially when we do use the third eye stimulation, because it takes the visuals take a lot of RAM. So it all depends on your laptop. It's not a problem of the device. It's not a problem of the software. So electrically, this client is too yin. We're too yin. Okay, it's emotional connection. See, my cursor is already starting to do funny things on me because I have too many things running. I'm going to close the iridology so we don't have any problems. Okay, so let's retest. So with the theory that I was talking about, stress as chronic stress creates that emotional overload, et cetera, et cetera. So, but the thing is that what we have to understand, when there is an overload and an exhaustion phase, it's not the problem of the actual person, and that's what they have to understand. It's the overload that's the issue, and that we have to reset neurologically the person so they can start feeling better. And it's an issue of signals. And maybe that's why they are anxious, or they have anxiety, or maybe they get angry easily because of this fatigue. And these are signals that are not sent properly to the body. Okay. Okay, let's go to the acumeridian first and do an unconscious choice. Superconscious choice. Let's see what's going to come up. Interesting. Okay, urinary issues and fertility issues. Now, this is the bladder 52. Let's take a more in-depth look at bladder 52. So we double click and we also notice what's coming up here. Kidney and bladder imbalance, excess yang or yin, patient sick, neurological overload. There we go. Let's do it again. Again, client may be pregnant. That's our third indication of something's going on. Okay, so the emotional connection to the bladder 52 has to do with fear, has to do with anxiety, emotional blockages, a lack of creativity possibly, some blockage there. Letting go, an issue of release and letting go. There's some blockages there. And again, an issue of grounding. Okay. So remember, our chronic stress is creating an issue with our grounding, and we need to be grounded. Possible infraction. Okay, that's not a good thing to see. And emotional overload can cause these issues of difficulty of letting. Sometimes we feel safe in our unsafetyness. All right. So that's where we need to increase the self-awareness. There we go. Okay, so we got that corrected. And let's go back here. Energy management, metabolic errors, blockage in liver, blockage in face, skeleton. Okay, so let's repair all. Okay, and repair it one more time to get that clear. All right, and let's close and close here. And just to finish off, it says auto color, so I would do the scalar through the auto color. So start the auto color and do the scalar to finish off the universal therapies. This is very important as part of your startup to align all your chakras. Very important. Reduces the stress, it balances your entire body, it grounds you, it makes you more coherent. Yeah. So what we can do then, thank you for sharing that with us. We can go to the body viewer, all right, and go to acupuncture and just load in the kidney for the grounding. There we go, kidney 1. Absolutely right. For grounding. So let that run. You know, I like to work with the unconscious because for some reason, certain things come up. I know sometimes we know things better, and that would be great since it's the best thing for the grounding. And you can do a combination, but work what you know, which is great, and we can do that, but also work the unconscious because for some reason, it also came up for that particular acupuncture point. In the beginning, I liked always to do what I thought what was needed to do, or protocols, or let's say, or whatever. But I started getting much better results when I started working the unconscious, whatever unconscious comes up. So, what happens with chronic fatigue and with coherence is that the mind and the body starts becoming disruptive and they're not coherent. And it's very important to have that interconnection, the mind and body. And this is where the nervous system integrates, and we create that loop, especially with the grounding and feeling present and in the moment and more confident. But there are certain programs that we're going to go into now that help with the mind and body connection. Because when the mind and body are not in sync, okay, this is when there's no clarity in the mind and the no focus that was coming up and the feeling of emotional overload or even difficulty trusting one's own self. All right, and the confidence in being there. Okay, it's not an issue of mindset. It's an issue of the internal system not communicating correctly. So it's not always a mindset. Sometimes we say, change your mindset. It's easy, but it's not only that. Chronic fatigue, we have to correct that issue of the chronic fatigue before we get into the mindset and affirmations, etc. Make the body feel safe and rested and reset. All right, so having said that, no, I'm not going to go into all this of taking everything over 85, but I would normally. Okay, but what's the lowest number? The lowest number is the future projection, worrying about the future. Apparently, we are worrying about the future more. There is some nostalgia and past trauma that needs to be addressed. But here, as the numbers I see, is more of a future issue. What is going to happen? What if this? What if that? All right, so I would normally do some therapy there. And you know what? I'm just going to close a little bit the third eye stimulation because it's affecting the whole process here because of the video going on at the same time. So I want to go into the NLP. Okay. Now, it's telling us that the blue here is telling us to go into the past trauma. I'm not going to go, this is a whole lesson in itself. So I can't go into that, but it is telling us to go into unconscious reactivity, which is past trauma. All right, but you need time to go into that. Don't go into that if you don't have time to work it afterwards, because you'd be scratching on past trauma, getting them up on the surface, and may disrupt and create crisis therapy. You need to know how to do what to do afterwards before you just do this. Okay, so I'm not going to go into that right now, but I do want to go into the superpower stimulation. I love the superpower stimulation. And let's see the unconscious choice, ESP, precognitive, this is interesting, and perfect pitch. Now, why would these three come up in the unconscious choices? ESP and precognitive is for your intuition. And apparently, okay, because with the pineal gland being off, us being in chronic stress, our intuition has been affected. And that's why these two are coming up. Now, perfect pitch has to do also with your thyroid. But perfect pitch also has to do with music, right? And the orchestra in your body, all right? Now, but it does definitely affect thyroid, the perfect pitch. Now, have this in mind. These are superpowers, right? So it's not only as I say it, but also as a superpower, as a part in the brain. Perfect pitch has to do with being able to repeat and replicate, let's say, music that I hear. This is a superpower. And so being able to replicate and having the focus in mind and clarity of mind. All right, so these are really good for us to do. Magic, window, unconscious choice, etheric, astral. Now, somewhere else I saw the astral. I think I saw it in the meridians, in the little purple box. It said something about the astral there. And that has to do with spirituality but also the etheric and high frequency degeneration. Okay, now what I want to go through is through the NLP, I want to go to start biofeedback therapy and relaxation. And here we'll see the mind and body connection. How is it? This is the chronic fatigue syndrome. Definitely we need to do the body to soul. And because of the spiritual that came up as the high stress, body to soul would also be important. Let's see, out of curiosity, the unconscious choice: addiction, meridian dryness, and bowel flora. Okay. So you see sometimes what I would want to do and what's coming up in the unconscious are two different things. Maybe it means that I'm not ready to do those therapies. Okay, let's do the unconscious here. Bubbles. I love bubbles. Bubbles gives oxygen to the body, all right, and oxygen to the brain. And it really is relaxing. All right, bubbles. Unconscious choice. Bad behavior in children. This is a good one. Why would bad behavior in children come up for us? Means that sometimes we as adults are stubborn. We're stubborn and we have blindfolds and we don't see the bigger picture. We're kind of set in the ways. That's what that means. And we have to do it because it does relax us. It relaxes us and it kind of opens up those blindfolds to see the bigger picture and maybe say, this doesn't matter, this is okay, not to be so stubborn, kind of go with the flow. All right, let's do one more. And stabilize speech. Okay, for speech. All right, now, what I would have done would be the relaxed mind, the mind and body connection, the mind and body connection. Is the body to soul. Endocrine for hormones, ear repair, okay, and immune stimulation. Let's just go to all of them. Degeneration a second time. Interesting how that, came up a second time. Karmic bonds and immune. Okay, so I would close here and let's go here. Unconscious done. Okay, this is a good one. Now, all right. We're ready to do the build self-image. This is the confidence that has been affected by the chronic stress. Okay. Build self-image and release negativity. Neural net and stabilization has to do with the biochemistry or hormones that are off due to the chronic stress. Again, creating anxiety. Okay, so, and the endocrine system did come up in biofeedback systemic as well. So because of our chronic stress and adrenals and the cortisol and the cholesterol, our biochemistry is just totally off. Stabilize, thanatos, and reduce. This is the self-sabotage. This is the self-sabotage that we're doing, and we're overdoing things and not relaxing and not resetting ourselves. All this we have to remember and we have to tell our clients is, this is information given to us. We do need to sleep at least 7 hours. We do need to eat proper small meals and not excessively. All right. We do need to relax. All right. We can do all these therapies, but they also need to do their homework. Okay, this is what the device is telling us. Homework is also needed to get the best results. Let's go to the magic. Okay, the magic we did. Let's go here. Adrenals, there we go. Spleen, adrenals, chakra, the parathyroid, and the DNA. for degeneration. A lot of degeneration was coming up, and we are going towards exhaustion phase. So these need to be worked on. Okay, so you get the picture. I just wanted to show you a little bit of how we go around a certain protocol, a certain therapy on a specific issues, doing the unconscious, trying to understand what's going on. Now, one more thing I want to see. There's so many things. I mean, you can be here for 5 hours, but you're saying the basic and you're unpeeling the onion. This is what I always tell my students. We're unpeeling the onion and we're trying to see one by one each time, getting better and better, and addressing our everyday habits to have better results here. How can we use stress reduction for chronic stress to now? There's something I don't understand in the question. Right. But when we're doing all these therapies, we're reducing the stress, but we're also getting information of what a person is doing that is creating their stress. So if we go into aging, let me show you just what this, maybe this will answer also your question. Right, when we go into the aging panel here, let's take a look at what is aging a person, us, for instance. We see melatonin is borderline, so we're not sleeping enough. We need more melatonin. Growth hormone is at 102, it's stressed. So again, it's saying that we're not sleeping the right hours and getting enough growth hormone. And this is coming up 2 times the growth hormone. Perverse energy, okay, maybe too much radiation, a little bit of a virus, calcium in tissues. Okay, so there's calcium and deposits in tissues. This needs more water, all right, more minerals, vitamin K, possibly. Okay, so sleep. This is the homework. And this is the indication and what's being given here. Let's also go to the nutrition panel one moment, because this is also another very important panel. There we go. Vitamin C, vitamin A, vitamin E, vitamin F, omega-3 for our neurological system. Very important. All right. So we work on these so that we can open up the pillar for better vitamin absorption. We see what needs to be done for each person, what needs to be taken with caution though, because we don't give vitamin A, right? Because vitamin A can be toxic if it's too much. In a multivitamin, there is always vitamin A. You can tell them to eat more carrots. You can eat, sweet potato or pumpkin or apricots that have vitamin A in food, okay, or multivitamins. Try not to give too much vitamin A because that can be toxic and you have to be careful. Just like B12. B12, you have to have blood exams. There is a small percentage of people that have very high B12, and that's usually because of a toxic liver, okay? Because all the Bs are water soluble. They should not be high. If a person is high in B12, it means that their liver is toxic, okay? And there's some kind of metabolic issue there. Vitamin F and fatty acids, omega-3s are always safe to give. No problem. Okay? And, do your hormones and your stress from cortisol and the stabilization here. These are very important therapies that you do, and it balances a person. These are all in stress reduction and helps reduce the chronic stress. When you're reducing the stress and helping neurologically, the person feels safe. The adaptation mode is changed. Let's go back to risks. There we go. You see? If we go towards alarm phase, it's the best. But we've left the exhaustion phase just with a little therapy that we did. Okay? Now, the information is endless. And it's I don't know if you guys have done your technician courses or your specialist courses or continuing education. I have a lot of students that do continuing education, and every year they do the specialist course one more time, for extra hours with me and mentoring, etc. So this is very important. The new cycle will be out in January. We'll be announcing it. It'll start in mid-January. We're going to be starting the next cycle of technician and specialist courses. So we're going to be uploading on the social media the next cycle and the days and the dates, etc. So keep in contact with us, and so that you can continue and we can delve deeper into our knowledge. I love teaching and I love to help you. So at this point, I'm going to wish you very, very happy holidays. I'm sending you love and light and hoping all the best. Thank you so much. I love being with you. Thank you so much for being with us today. And we'll keep in touch. Anything you need, I'm here to always help. Okay? And I would love to see you in the next specialist or technician course. Happy holidays to everyone and a happy, happy, happy new year.